Greetings. My name is Dr. Jacob Curtis. I'm a board-certified family physician at Grand Peaks Medical in Rexburg and St. Anthony, Idaho. I also have the privilege and opportunity of serving as their medical director. In addition to my board certification in family medicine, I also have advanced training in emergency medicine as well as obstetrics. This topic that we're going to cover in our educational presentation sadly has become one of polarization during this pandemic year in which it was prepared and created. The purpose of this isn't to contribute to add to the controversy and divisiveness, but rather a hope and a plea as a physician for nearly 20 years to share what the current scientific evidence shows, not in a got you sort of way. This is not for individuals who are wearing masks 24/7 and condemning those who do not and feeling like those who do not are selfish and evil and should be eliminated from the face of the earth. This isn't really intended for that population or that way of thinking, I should say. Nor is it from those who have very strong feelings to feel like nobody should be wearing masks. It's a government-controlled idea, that it's likened to something that may exist in Germany in World War II or is a conspiracy theory. Rather, the purpose of this, and I would just say about both of those populations, I've seen some who stand on both sides. We do see more healthcare medicine on this side of pro, but I also know these individuals, oftentimes historically associated with more rural areas, they are the salt of the earth. These individuals who have these mask concerns, as I've interacted with them, they're my neighbors in rural areas who give their shirt off their back and go out in the rain and the snow to help their neighbors. And so I would just submit that I know both populations, and they're both good people with good intents, but we live in such an uncertain time with so much controversy and even misinformation. And so what I've attempted to do in these next 10 minutes together is to share with you, as of this early December date, 2020, where we stand with the current scientific evidence. That sounds cliche. What does scientific evidence mean? Historically, the ideal scientific evidence is a randomized controlled trial. Unfortunately, during a pandemic year, we don't have the months and years it takes to have a well-designed randomized controlled trial of those who do and don't. And so most of our resources or information is based on observational and retrospective studies. But before we scoff at that and say we don't have good scientific research, it's important to realize that a lot of things that we do aren't necessarily based on randomized controlled trials. I just 2 months ago went skydiving with my 18-year-old on her 18th birthday, and it's important to know that parachutes have never been studied in a randomized controlled trial, yet we know that they work. And so I'll admit that as a healthcare provider, I definitely am a little bit more aware of the information that shows that there might be some benefit, but also very empathetic to those who have concerns. And so I'm going to try and be as objective and non-judgmental as we go through, just sharing, answering questions and identifying myths and perhaps fallacies along this whole topic that's become debated. I've based a lot of this information by Dr. Schmerling. He's a faculty at Harvard. I've received his permission to go over this information that he provided just 2 weeks ago. So we have surging COVID-19 rates throughout the country and in the world. Just listening to my news station this morning, there were 2,700 deaths yesterday in the United States. That's the highest number of deaths in a single day since this pandemic began. It doesn't appear to be going away right now. It's affected several million throughout the world, and over 1 million have lost their lives. And so it is something that does require, it is sobering. I think there's enough data to show that this isn't just made up. This is something that has affected us all. I'd be shocked if there isn't an American out there who hasn't been affected by a loved one or extended family member or friend who's been affected by this disease. Some with very mild symptoms, 95%, but some with more severe. I'll admit that I'm somewhat biased because I'm also one of the frontline workers in the emergency department. I've been an ER doc for 15 years, and so I'm seeing the worst of the worst cases daily, and I just worked yesterday, and it was a pretty sad and sobering day with some pretty sick individuals from their late 70s, early 80s to an 18-year-old young man with severe complications. So experts, scientific experts, researchers, estimate that we can save hundreds of thousands of lives and considerably boost chances of controlling it if we commit to the following practices. Maintaining physical distance. How far? We hear the 6 feet just because of the belief that most of the way it's spread seems to be through respiratory droplet, but also some aerosolization. Rarely does it travel more than 6 feet. Some studies show that in normal conversation voice, 3 feet might be even beneficial necessary. Washing hands with an appropriate antimicrobial type agent can really help to eliminate washing surfaces. I smile because I think we've been better this year than we've been in our whole lives about wiping down our surfaces and keeping our hands clean. And consequently, outside of COVID, we've seen a reduction in other things that we normally see. I was just talking with our video producers how in the springtime we saw fewer upper respiratory infections and even influenza than we had seen in decades. Avoiding others if you're sick. Specifically, if you're having a cough, fever, even if you did a test and it was negative, just being respectful to know that disease, whatever the source might be, is spread by active infection signs and symptoms such as fever and cough. And then isolating yourself and consider getting tested if you have close contact. I must admit that there are some consequences with the testing process, but we're trying to work on that and improve that process too. So a common question I get asked is, I thought the research has shown that they didn't work. I think it's important to go back into the early days of the pandemic as it affected our nation in March and April. Some of the experts, including Dr. Anthony Fauci, was on 60 Minutes and said, I don't think everybody needs to wear masks, just those who are at most risk, because that was our understanding at that time. But like all things in life and science, as we get more information, sometimes recommendations change. Just 200 years ago, doctors thought smoking was actually beneficial. It wasn't until 1950 that the American Heart and Lung Association said, we have now reason to believe that it's associated with lung cancer. And so I'd say so is true. What we're doing today may be different than next year, but that doesn't mean we should ignore the current recommendations. These are hardworking scientists. Many are putting in 80 hours plus a week trying to identify what's going to best help the American population that are also made up of their friends and neighbors. And so sometimes I see, as I've tried to go to both sources of information, I've seen that video going around as though it's current, and unfortunately, I shouldn't say unfortunately, but it's not current. Even Dr. Fauci said 5 weeks later that's no longer true, but sometimes there can be some misinformation spread based on previous recommendations. In addition, there was some concern in the beginning about mask shortage. It was very real. It was very worse than at the hospital I worked at. And so a lot of people, Americans, came together in the way that Americans do. Technological advances and industry was enhanced to be able to meet the demands. And now we have more resources to help us all out, and especially healthcare workers. And so that mask shortage is no longer the concern that it was back in March and April. So why do we believe they work now? If somebody's saying, why should I believe you, doc? Since the beginning, there's rapidly expanding body of evidence. And I'll cite this article again at the end. That was the primary. There's about 14 studies that have come out in the last 3 months, really showing that based on observational studies, it seems to be helping make a difference. Is it dramatic and life-changing? I don't know. But if that life that it helps to reduce the spread to is your mom or dad, it could make all the difference for us. And so there is evidence that shows that the benefit of non-medical masks, cloth included, can help to reduce the evidence of spread. Some of the strongest evidence includes reviews and observational studies that shows that it does seem to be associated with lower rates of infection. How do they work? Intuitively, they trap the large respiratory droplets to decrease the spread of the disease. It doesn't take an advanced medical doctorate to be able to kind of intuitively see how that might theoretically work. Where are we still seeking answers? The next 4 slides address these questions. Which type of mask is best? Does wearing a mask protect others that wear or both? Do masks reduce the severity? And is it necessary to wear it outdoors or in our car by ourselves? And so according to the CDC, it's best to choose one that's comfortable, washable, breathable, tightly woven fabric, breast. The gaiters and the bandanas seem to be a little less effective at isolating, but they all average. The reason that N95 has its name N95 is because its design is to reduce 95% of particulate matter from going beyond the user. In theory and actuality, because of leaks and such, it's probably 90%, which isn't bad. Most cloth masks seem to be around 80%. Some of the gaiters might be as low as 60%, but still that's helping us significantly decrease the burden. We're not trying to eradicate the disease. We can't with the mask, but we're simply trying to slow down the spread so healthcare resources, such as the one I worked at yesterday, which is absolutely sound, is better able to meet the needs. We're running out of beds through eastern Idaho and throughout the country. And so if we can engage in measures to help to slow that down, helps us to better treat our patients. It's important to know that I've seen some of the masks with valves, they might be a little less effective because viral particles can leave in those particular devices. Does it protect others? The wearer, both. Early, and going back to that Dr. Fauci video recorded in March, when evidence was more limited than it is now, mask wearing was primarily with the plea to help protect the vulnerable, our elderly. And that's still a huge concern. They are the individuals who seem to be dying from this disease more than any other population. But it also can have some benefit to the wearer and to their family too. Probably, it's tough to say how much. It kind of depends on where you're at and other circumstances and other factors too. Do they reduce the severity of infection? There's more emerging data showing that can help to decrease the viral load. And it makes sense. I learned this in a way when I went as a child to SeaWorld for the first time as a young boy, back when they had the Shamu shows, and I gained an appreciation of the splash guard. It didn't reduce all the splash from the large killer whale, but rather it helped to decrease some of that burn. Masks work in a very analogous manner. It's not going to reduce everything, but it can help to decrease some. On a personal note, I've been in contact with approximately 80 to 100 COVID positive patients. Since March, we get a scorecard in the emergency department. I've been fortunate so far that I haven't had COVID symptoms, but I tested my antibodies 3 weeks ago and they were positive. Hopefully it doesn't mean I was walking around spreading asymptomatically, but likely the belief is that when we wear a mask, we're still going to probably have some antigenic viral exposure, but it's significantly decreasing that burden to make this amazing human body that we've been blessed to have, to allow it enough opportunity and time to develop antibodies without necessary overt symptoms. And so masks seem to be able to help us with that. One concern is that if mask wearers believe they're protected, we could be more cavalier. One of my favorite football teams I like to watch in the fall had a victorious win against the #1 team a few weeks ago, and the students stormed the field. I did smile that most were wearing masks, but obviously we need to be careful that we still don't engage in other less safe type behaviors. Is it necessary to wear it outdoors and by your car yourself? Probably not. If you're going for a walk outdoors away from others, it seems to be less necessary. It seems to kind of be the target of some ridicule and jokes. Not that we should just come to teasing, but especially in a car by yourself, doesn't seem like that's the risk. The highest risk places are when you're in concentrated areas with many people around and less than 6 feet of space. So crowded areas, grocery stores, restaurants before you get into your isolated table, and other places like that might be times to consider, just decreasing that burden of spread of individuals you might have contact with. I also want to address something that was expressed in the concern. Some people worry about CO2 retention. Wearing a mask, is that harmful for your health? When I've worn a mask strictly all day long, you feel kind of lousy. You don't feel great. And so when I'm greater than 6 feet away from people, including recording this right now, usually drop it just for mental health, but again, getting in that less than 6 feet of space, trying to be strict. And so going back to the CO2 retention, unless you have underlying COPD, emphysema on oxygen, the likelihood for an average healthy American to have clinically significant CO2 retention is pretty low. And that's been well evaluated and studied too. Do's and don'ts, it should fit snugly. I have some demonstrations of different types of masks, but I think we know what they are. Is just going to demonstrate wearing below the nose, protects the mouth, but we still have some respiratory access to the nasal passages. Wearing on the chin, the chin bra probably doesn't help quite as much, although I'm guilty of doing that before I get into somebody's 6 feet of space. And so avoiding the gaps. It should be comfortable. I really like one produced by a large company here in this area that's kind of more of a neoprene material. Again, it's probably not as effective as the N95 that I use when I go into a sick patient's room. But try different styles, make sure they're washed regularly. There was a sad case of an OB/GYN resident who had underlying asthma, who during the early days was wearing the same N95 over and over again to try and save supply, and actually succumbed from the disease. And so make sure we're taking proper care there. So the bottom line is, if we're going to make meaningful progress, or at least slow down, just embracing the science and opinions, being respectful of others, trying to do our part. There are so many areas of uncertainty. What we believe to be true right now could be modified in some ways. Evolving guidelines doesn't mean that the experts don't know what they're doing. It just means they're making their decisions and recommendations for us all. I hope that we can be more unified, not judge others who are strictly mask-wearing, not judge others who don't necessarily believe in that time, but just try to do our part to decrease the burden of the spread to protect those that we love. And so thank you for all that you're doing, the way that you give back to your communities. And again, I'll also go back to the beginning. So if you have desire to reference this article and look at the 13 published papers in the last 3 months, you can go to Dr. Schmerling's Mass Saves Lives. Here's what you need to do in Harvard Health, published just 2 weeks ago. Thank you.